Is cutting edge. This is something that we have been able to do relatively quickly, to the point that no less than New York City could only do this as recently as last week. So the fact that it's here in Toledo as quickly as it is a credit to our partners, but especially Mercy Health Toledo. I see Matt Sapera here and other officials from Mercy. This would not be possible, and the life-saving technology that we will be able to offer our first responders is invaluable. We just can't thank them enough. So without further ado, I'm going to turn it over to Dr. Casey to have him explain a little bit more about what's happening here today.
Thank you, Mr. Mayor. Mercy Health has partnered with law enforcement, fire, and EMS agencies to test the first responders in Lucas County and the city of Toledo for antibodies associated with the COVID-19. This is considered a research project, and we are hopeful that the data collected with this project will be used to help the scientific community better understand the impact of immunity as it is more clearly defined. Mercy Health is proud to be partnering with the city and the county to lead this important work as we continue to adapt during this unprecedented time. This project will focus on first responders because this group is at high risk for exposure to the virus. The project is voluntary, and only those who are willing will be tested. Again, a positive test does not mean that the individual has immunity to the virus, as we don't have enough clear scientific evidence of that yet. However, Mercy Health believes that this is important work, and we are proud to be standing beside our partners to announce this initiative today. We are also hopeful that this testing will continue to build on our local convalescent plasma treatment protocol and processes for COVID-19. Mercy Health has recently announced a partnership with the American Red Cross in which convalescent plasma is collected from individuals who have recovered from the virus. This is then administered to patients with COVID-19 who are at high risk for progression to severe or life-threatening stage of the disease. The work has already begun in this community, and we are looking forward to expanding the program even farther. I want to say again how proud I am to be standing here as part of this new initiative. Today's announcement further demonstrates Mercy Health's commitment to this community, and in particular to the first responders who protect us all. Now I'll ask the Health Commissioner to explain more about the testing and the process can aid in determining the spread of the disease. Mr. Commissioner.
Thank you, Doctor. What a great day it is for Toledo-Lucas County to be able to partner with Mercy Health and offer antibody testing to our brave first responders. Again, it is so important that we start doing this for our first responders. Like the mayor said, New York has just been able to offer it, and here it is. Again, Toledo is on the cutting edge of so many different things, and this is another one of those ventures that I am just proud to be a part of. Let me talk a little bit about the testing itself. Remember, there's two different types of tests here that we want to discuss. One is that PCR testing where you have the nasal swab. Again, they take the swab, they send that off. That is talking about your infection at that point in time, and that's your immediate condition. So when we start seeing numbers, and so far we've tested well over 12,000 individuals in Lucas County, again, about 12,000 individuals we've tested through PCR. What we're trying to figure out is if you actually had the disease at that point in time. That's important for us because if we don't know that you're infectious, we can't do that contact tracing, we can't get you to self-quarantine and then, again, put a halt to the spread of the disease. What we're doing here with our first responders, and we want to do more with our community, is the antibody testing. A little bit different. What we're trying to figure out is if you've been infectious. And the antibody test, I don't want to go real deep into the science behind this, but what the antibody test is, it's instead of the nasal sample, you're actually getting a blood draw like you would at a doctor's office. They're going to go ahead and test that, and they're testing to see if you've had the disease itself. Not that you're infectious, but if you actually had it. Why is that important? Well, that's important for a number of different reasons. One is that, as Doctor said, we're looking at the immunity of the community. We would expect, like other diseases in the community, flu and other viruses, that we're going to have some immunity to be able to fight off this disease for some of our population. We don't know what that is right now. It's also important for our first responders to understand, have they actually been exposed as well too, to decide then, again, looking at resources and looking at the first responders to see where they stand with that immunity as well. As we go through this testing process, I think what it's going to be able to do too is give us another section, cross-section of our community, which is those first responders, to figure out what their immunity is, and then compare that to as we go through testing other individuals and other groups in the community of their antibody levels as well. As we go through the coming weeks and months, like anything else, we're going to be learning more about this coronavirus and how it not only affects us, but long-term affected the community. So the more data that we have, the better off we're going to be able to, again, react to either a spike or a second wave. So the quicker that we can get data, the better off we're going to be. Again, I think I just want to hearken what Doctor said about the actual plasma and use of plasma. That is extremely important. So again, with the idea of we know who has antibodies to COVID-19, we could actually utilize that for a possible treatment. So there are so many more things that we want to talk about, and so many great things that this test is going to be able to give us. I'd like to ask Commissioner Gerken to come up and talk a little bit more. Thank you.
Good morning. Thank you, Mayor. Thank you, Eric. Thank you, Doctor. And I want to thank the members of the press that are here, all wearing their masks and following the guidance that we've been giving out for such a long time. I also want to take a minute to thank all those in the community that do decide to wear masks to protect themselves and others. Thank you for those people that make that free decision to do that. It helps. Here is another chance. Thank you to thank Mercy. Thank you for stepping up for a real positive opportunity for us to understand what's going on in our community. There's a saying I always like to repeat that says, little knowledge, little power. No knowledge, no power. Better knowledge, greater and better power. We're getting knowledge out of this, which gives us better power. The more you know, the more then you can react. If you're at home and you have a first responder coming to you, you have a need, and you want them to assess your health risk at that point, but you also are probably thinking, what is the health of the responder coming to me? This is why this program is critical, because we can kind of help people understand the health of the responder coming to help you. If you're in dire need, you want to know that the person coming to you has some idea where they're at in the COVID process. We've created through the EOC, the Emergency Operations Center, and in partnership with Lucas County and the Health Department, something called a Health and Wellness Officer. Here's how it works. It's very important for the first responders and the community. If I'm a first responder, I go into a situation, I'm pretty sure that I've been exposed to COVID-19, I'll come back and report that to the Health and Wellness Officer. That's important. That's an important first step. That Health and Wellness Officer then will take your information and give it to a physician team member. There's a team of physicians ready to take those calls from the Health and Wellness Officer, and they will make some judgment based on you have symptoms or not, what to do. They could, number one, you could be placed in quarantine, which is not isolation, in quarantine, while you see if your exposure manifests any symptoms. Or if you're having the symptoms right away, you can be placed in isolation and given the test that we talked about, the nasal swab test. When we start giving this antibody test across the board and up front before even an exposure to health and to first responders, it's going to give us that extra piece of knowledge and power that they have to do it. Again, the test is voluntary. We cannot constrict or make anybody do it. Knowing our first responders who want to be the best prepared, we hope that there's a strong response to do that. But now, we can know which of our first responders may have had exposure and might have been symptomatic. We all know that there's a portion of the population that has had the exposure, was asymptomatic, and maybe not even know that they had it and could still be walking around contributing to community spread. We certainly don't want that in our first responders, who are making more and more runs than we've seen in a long time. When you combine this, the nasal swab, the Health and Wellness Officer's report, and the physician team, we are creating a real guard around our first responders, as much as there is in the country. I think somebody mentioned that. We're doing more than New York City to do this. So this isn't one tool. This is a series of tools we're doing to protect our first responders. The better they are, the more of them that they are out there, the more we know, the more we can have first responders out there and have safe first responders out there, the better we're going to be able to serve the community and get through this. So without this partnership with Mercy, we would be more at risk. With this partnership and these tests, we are less at risk again. No knowledge, no power. Some knowledge, some power. A lot of knowledge, a lot of power. This is giving us knowledge and power. I think that's it.
Questions?
Doctor, we have to come forward. You mentioned that just because you tested, that exposed to and that was specific, like people down there, a lot of people feel that if they test positive for antibodies,
That's exactly right. So we just don't have enough knowledge at this time to know if there's any immunity that goes along with someone who has been infected and recovered from COVID-19. We have reason to suspect there might be. The other coronaviruses, MERS and SARS, there was some immunity conveyed with that. We just don't have enough information yet to make a definitive statement and to risk people's lives on that belief at this time.
do you recommend that, the general public get these antibody tests, or that provide a false sense of security?
I would recommend that each person in the community talk with their own physician, their own provider, have that discussion about what are the chances of me being exposed, what are the environments I'm going to be in where this information might be meaningful. Particularly, this might be useful in the future if and when a vaccine gets developed. I think we've all learned over the past few months that we don't necessarily have immediate supplies necessary to treat everybody the way we would like to. The purpose of a vaccine is to develop these same antibodies we're testing for. So whether there's immunity or not, maybe people who don't have the antibodies, they might be first in line to get the vaccine. We don't know. That's just, we're gathering the information and don't have enough to say anything conclusively yet.
And this is part of a research project being run out of the CDC.
We're running it locally out of with Mercy Health and the partnership of the town and the community and the city.
Yes.
If someone who just wants to be tested for coronavirus goes through one of those drive-through facilities, are they going to get necessarily the most accurate results if they are not symptomatic?
Well, relative to the PCR testing, we found out that that really has the best results when you are symptomatic. The antibody test is a little bit different. Again, you've already went through the disease progression. So you could have been asymptomatic, and that's when you want to find out, well, did I have it or not? I was tested, and I was negative. Again, with the issues that we had at my department, figured it would be a good thing to see if I was antibody positive, and I was not. So.
Gotcha. And anything you can provide based off the weekend and how the holiday weekend went? We saw a couple pictures of big gatherings, but are people kind of starting to get the gist of when they go out, how to social distance and how to stay safe?
Well, let me just talk real quick about the social distancing aspect in restaurants. We had sanitarians out all weekend, and the one sanitarian spent Saturday afternoon and evening, saw about 50 places. Out of there, we had 2 issues. Everybody else was pretty much in compliance. We did hear of some issues, though, with some large gatherings. That is a concern. So for the most part, I think the restaurants or bars are trying to do whatever they can to adhere to that social distancing. However, we have some groups in the community that probably need a little bit more education.
Do you have to clamp down at all? I mean, did anyone, you have to step in and bring yourself up?
We did not. No, we did not. Again, a lot of this is education, remember? I mean, this is all new to everybody. And the issue that we had, of course, is the guidance documents, trying to make sure that everybody understands those. And then getting into those some of those facilities, too, where they thought maybe they were doing social distancing, like between tables, but maybe they needed some extra help.
Can I just real quick? I'm sorry. I agree, obviously, everything the health commissioner said. However, I would, and maybe you already know this, I'm not sure. I hope it's a public document. It's about to be. The state of Ohio, their task force, the new strike force that Governor DeWine impaneled, on the first night that they went out to enforce, they visited 628 different establishments in the state of Ohio. They only issued 11 citations and only had to close one business, but that business was in Toledo. I mean, that the only one that was the only bar or restaurant that was closed happened to be in Toledo, and actually I think 3 of the 11 citations were in Toledo. So, statewide, I think those numbers are encouraging, but it is worth noting that here in Toledo, we had the one non-compliant restaurant or bar that had to be closed. So.
I guess I know that we talked about this really bad, but now that the date's kind of getting closer, there was talk of restaurant or streets possibly being blocked off for restaurants to stand
Yeah.
out. I guess where is that?
No, we will have guidance on that this Friday. We said all along that May 29th was the date we'd announced that, and we're still on schedule to do that.
Mayor, which restaurants were shut down? It's public record. I mean,
Yes.
it's public record.
I want to get the name right. It's Jake Saloon? Yeah, Jake Saloon on Dorr Street. So,
So, for the health commissioner,
Yes.
so even if a first responder was never tested for the coronavirus, they can get tested for coronavirus.
One more time, I'm sorry.
Can I take this off?
Yeah, go ahead.
So even if a first responder never was tested for coronavirus, they can still get it.
Yes. Again, please remember that a lot of disease in the community. I shouldn't say a lot. Excuse me. That's a very bad definition. There's a considerable amount of disease in the community that was asymptomatic. So again, you don't know whether you were infectious or not, and this antibody test will help you.
And this is starting immediately, correct?
Yes.
You have the chief, the fire chief, are you able to come up, Chief?
Frank.
All right.
What is your response to including all your first responders to this? I mean, where do you see this? Are you glad that it's happening? I mean, how are your crews doing? How is the rescue population doing here? So much has been done on protecting them, and rightfully so.
Yeah, first I want to, thank the agencies and Mercy and the health department and everyone for doing this for our personnel. This came about pretty quickly, so thank you. This gives a chance to gather some useful data on how or what effect this virus has had on our first responders. There's all these unknowns. Are people symptomatic, asymptomatic? Did they test positive? Did they not test positive? Were they sick at all? So this gives us some information to hopefully, the medical professionals can use to help combat anything like this in the future and even what's going on now. So I want to thank them for doing this. And yes, it means a lot to not just Toledo Fire and Toledo Police, but all the first responders across the county.
How stressful has it been for your crews? Because the process that you just talked about, that the patient tested positive, I mean, that's a lot of additional stress on crews to not know the unknown. How do you address that?
This has been very stressful on our crews because they're going into what would have, before this virus, been normal EMS responses to sick people. Well, now everyone they go to, they don't know whether is this just somebody who has, a routine illness, or is this someone who may be positive for COVID-19. And the other big impact this has on our people is they're working a 24-hour shift. They're being potentially exposed numerous times in a 24-hour shift. Now, we provide them the PPE and so forth, but then they're concerned with going home and taking it to their families. So, we're walking into people's homes. These aren't necessarily the controlled environments of a medical facility. We're going into people's homes, so we're walking into unknowns, dealing with an unknown. So yes, it is extremely stressful on our people, but we're trying to provide them with everything that we can so they can make the best decisions about not only patient care, but how to protect themselves too. Thank you.
Good job, guys. Nice job, Doctor. Good job. Always. Good job. All right. Nice to meet you.
Yeah.